Hi, Lori here. Welcome to diabeteslearnhealthy.com. Today we're going to do a quick crash course in diabetes. You ready? Let's get started. So let's take diabetes out of the body and put it where it really is. Diabetes is about the pancreas. The pancreas produces insulin, which is a hormone. Insulin helps move glucose into the cells. Utilizing the glucose as energy from the blood lowers the glucose in the vascular supply, returning it to a normal range. So now let's really go through that. So when you eat food, carbohydrates, it breaks down into glucose. And glucose is energy for your cells. So your pancreas is aware that the vascular system glucose level is elevating. It releases insulin into the vascular system. That insulin helps transport glucose from the vascular system into your cells so your cells can function, lowering the glucose in the vascular system, returning it to a normal range. So let's really think about that. Diabetes is really about a process of the glucose being able to be transported into your cells, lowering the glucose in the vascular supply, utilizing it for energy. So as it returns to normal range, your normal target ranges for your blood glucose are above 80 and less than 180 micrograms per deciliter. Yes, your goal is in the morning to start with around 80 to 130 micrograms per deciliter, but throughout the day, you're really trying to keep the blood glucose above 80 and less than 180 post-meal. So why is it so important to keep your vascular system between those two numbers, your red blood cells? So let's think about that. Your red blood cells circulate in the vascular supply 90 to 120 days. So while they're circulating through there, your heart is pumping those nice soft red blood cells that pick up oxygen on the hemoglobin protein, picks up oxygen and leaves the large vessels and goes into our small vessels, our microvessels, and our kidneys, our heart, our brain, our muscles, our body to function properly. So now we're really talking about our red blood cells and how they help transport oxygen and nutrients into our tissue. And so if unused glucose remains in the vascular system, it coats our red blood cells. So those red blood cells, what happens is if they get coated, they can't pick up the oxygen, but they can also clump and bind, and then they're unable to leave the large vessels into those microvessels. So we're looking at trying to keep this whole system working properly. So our goal is again to keep the vascular supply between those two numbers so that our red blood cells stay healthy. So when you go to a primary care or they do a hemoglobin A1C, they're actually weighing, it's a weighted measurement on those red blood cells, the glycemic coating. So when we talk about reference ranges, or what we're looking for is a 5.6 or lower is pretty much your goal. We're also looking at if it's a 6.4 percentage weighting, you may be at risk. If it's a 6.5, you may be diagnosed with diabetes. And so they'll also look at other labs as a fasting blood glucose, which means you have not eaten in 8 hours. And that would be a blood glucose less than 126. And then also you'd be evaluated for, did you have an infection? Have you been on a medication that maybe makes you insulin resistant before you get that diagnosis of diabetes? So we're looking at trying to keep our red blood cells healthy. That hemoglobin A1C test can also monitor the health status pretty much of your microvascular and macrovascular system. So that is something that your primary care is monitoring to see if you're at risk for stroke and heart attack, poor wound healing, and other damages to your vascular system and your organs. So let's talk about how do we keep that vascular system between those two numbers. Well, we've all heard diet and exercise, but let's really talk about the types of diabetes, and that's going to help you understand better what your lifestyle changes and choices might need to be. So let's talk about type 1. So type 1 diabetes, no insulin production, genetics, infections, environmental triggers, chemicals. Well, we do know that any age can be diagnosed with type 1. I see many people in their mid-20s and also in their late 40s and 50s. There are spontaneous type 1 diabetics. We also know that type 2 has two parts to it. So about 90 to 95% of people diagnosed with diabetes are going to be diagnosed with type 2. So type 2 has two parts. Do you produce insulin? Does your pancreas make 100% insulin? That's something you'll work with your primary care as you are doing the consistent carbohydrate diet changes, and then also insulin resistance. Insulin resistance are lifestyle changes and choices you can make to help those cells utilize the glucose better. So let's talk about insulin resistant. So when your insulin is trying to transport the glucose into those cells so they can function, the cells get a wall around them, a cytokine, and inflammation. So it requires a higher amount of insulin for that cell to be able to receive the glucose. So the process again is not working. How do we thin that wall on those cells so that the cells are receiving glucose better and that the glucose level is lowering in the vascular system? So we know that weight, medications, inflammation can all cause insulin resistance. So let's think about that. So weight can help those cells. If you lose weight, those cells will utilize the glucose much better. We also know that medications such as steroids cause insulin resistance, but the benefit of the steroid outweighs the insulin resistance. So many people need to be on steroids for breathing, for pain, joint pain, autoimmune. So again, you'll work with your primary care for the insulin resistant for helping to get those blood glucose in target ranges. Infection. So if you have an infection, that infection needs to be cleared up. Again, you'll work with your primary care. Inflammation, joint pain. What you'll also do is be evaluated, work with your primary care, maybe physical therapy, or have whatever's needs to be resolved will be resolved. And then stress. So stress can cause insulin resistance. So stress is a cortisol. Your body produces is that fight or flight hormone, but actually stress is good. So you have to really think about what kind of stress you're thinking about or experiencing. So there's a distress, an event, a death, something that's going on at that moment that you'll have to learn or have practice things that can help you process it and how you respond with exercise, meditation, pray, walking, whatever you need to do to work through that. And then there's another kind of stress. It's called eustress, E-U-S-T-R-E-S-S. I like that stress. So that stress is your motivator stress. And it helps you get up and say, hey, I have something I need to do. Let's go get it done. So it's really important to kind of distinguish if it's a distress, is it that good emotional stress that's telling you get up and get going, and then move forward and just learn new lifestyle skills that are going to help improve that. And then pregnancy. So pregnancy is a good hormone because you're pregnant and it produces an insulin resistance, such as gestational diabetes, insulin resistance. That will normally resolve once you deliver your primary care that will monitor you for persistent diabetes. And then there's a 1.5 LAD-A diabetes. That's an autoimmune of the adult. So what happens in that situation is the T cells, your immune cells, destroy the beta cells. And so it's a spontaneous, and normally that person would have lost weight unintentional, frequent urination, maybe some blurred vision, absolute fatigue, they will seek medical care and find out that they have a 7 or a 900 blood sugar and A1C around 11, 12, 13. And so again, think about that. If your red blood cells have a candy coating, a glycemic coating of 12 or 13, they can't pick up oxygen and carry it into your muscles and your tissue in your body. How fatiguing that would be. So those patients would be evaluated and then probably diagnosed with a 1.5. I see a group of mid-20s and then also another group in the 50s that have been spontaneous type 1. No family history of diabetes. So that person would be put on an insulin to carb ratio. So they will count their carbohydrates and be on a mealtime insulin and a long-acting insulin, and they actually do very, very well. So whether you have type 1 or type 2 diabetes, your goal is to eat a consistent amount of carbohydrates every day so that your pancreas makes insulin so your body can utilize those glucose. If you are on insulin, then still again, you're on a dose of insulin that's supposed to mimic what the pancreas is doing. You would still be on a consistent carbohydrate meal plan. So if it's a scheduled or a set dose, you certainly want to make sure that you're eating the same amount throughout each day. So for more information and the full version, I'll see you at diabeteslearnhealthy.com.